Okay. All right. Thank you for for watching this. We've got Dr. Brian Gill here, who is a surgeon at IHC in Provo, and we've got Dr. Paul Kay, who is a pathologist. And I like to say he is a full-time advisor and a part-time pathologist for PPAC, but it's actually kind of the other way. So I wanted to talk to both of you to learn more about the state of shadowing and kind of what's going on with COVID. I mean, there's part of me that every day I see people getting vaccinated and I think we're so close, and yet like what's happening? Dr. Gill, do you want to start and kind of tell us about what it was like and where it's at right now?
Yes, I would like to start just historically that Utah County and the 6 hospitals that are around BYU have had ups and downs with shadowing. There's been times where different administrators have been willing to open the doors widely, and then a deluge of students comes into the hospital and things get out of hand, and a few wild shadowing students wreck everything for the ones to follow. And so there've been times when the doors have tightened. Before COVID hit, we actually were experiencing a tight ship at our HCA hospitals, which is the Hospital Timpanogos and Mountain View in Orem and Payson, respectively. Pre-med students are not able to get in there even a year prior to the COVID advent. The Intermountain hospitals, Utah Valley, American Fork, and now next month, Spanish Fork, are much more agreeable to allow students to come, but they do have tight guidelines. And they require students, when it's permissible, to meet those standards and to obtain their volunteer badges or their shadowing badges to be able to be identified as shadowing students when they do come to the hospital. Having said that, last March, COVID even shut the doors at our IHC facilities. And so part of the problem has been getting the students that need their hours into doctors' offices, since the hospitals are right now closed with COVID restrictions. I've worked in the class that I teach at BYU, which is partly based on shadowing experiences, to open as many physician offices as possible. And even last spring and through the fall 2020 during COVID, I found most physicians very willing to allow students to come into their offices for 2 or maybe 3 hour time slots for shadowing, which fit the students' schedules great. But then things even started to tighten down for winter semester or start of 2021, excuse me, even in the offices, as hospital administrators were getting a little more nervous and felt like we hadn't reached full vaccination or herd immunity status yet, but the end was in sight, and so they didn't want to jeopardize much. So many of the places or the offices that were allowing students, even in December, were not in January. I've probably talked too much already.
No, I think it's just helpful because I think students see the shadowing requirement on so many different kind of applications. You know, like the health professional schools really do want this shadowing requirement. And so seeing that it's kind of not available to them or not an option is good to know. And yet at the same time, what are they going to do?
Right. I would like to add one thing so that we don't end my last comment on a bad or a downer note for the students. Despite COVID, physicians are very eager to be able to have students shadow them, visit with them, and learn what they will. So I think that the opportunities are still out there, even in these times of restriction. So part of our discussion today should be about avenues or ways for students to be creative in reaching out and finding people that are willing to make one-on-one connections so they can get into offices or meet different surgery centers or places that will allow them to come in.
I'd like to build off what Brian just said, because I think there's a lot of truth to that. I started working as Christina said, I'd like to be a full-time advisor and part-time pathologist, but living in Illinois, I do as much as I can. I love working with the students, by the way. But when COVID hit last spring, we were brainstorming as advisors about what could we do. And the idea was hatched that maybe, and I think I was talking to Brian about this, is maybe physicians would be willing just to talk over the phone. And so we have started a new alumni group of physicians from BYU. And as I talked to a lot of physicians, there is a great desire of physicians to help students. And those who are alumni for BYU or LDS and love BYU like me, they want to help. And so we gathered some names of physicians. I trained at the Mayo Clinic in Minnesota and was on staff there for a bit. And I contacted some people up there, and we had a list of physicians who were willing to talk to other physicians I'd met. And I have to tell you that universally, the physicians really enjoyed those opportunities to talk to students. And so there are ways to contact and engage physicians that isn't equal to shadowing, but will still educate you and help you prepare for the future, I think.
Okay. So a follow-up to that is just I can see students watching this and say, well, Dr. K, where can I get that list? I'm going to start dialing, or I'm going to start texting, probably.
Well, I have a list of some, and if somebody wants to contact me, no, but we have shared that list with the pre-med club, and the pre-med club is also gathering physicians. And so I think one place to start might be with the pre-med club officers and talking to them about the connections they're trying to make as well. I think a valid place to start, to be honest, probably the most powerful thing to do is to look at your own networking source of people in your life, your physician, your parents' physicians, somebody in your ward who's a physician, particularly if you're not from Utah Valley back home, wherever that might be, and connect with those people. Ask them if they can talk to them. When you travel back, can I shadow with you? Because those type of opportunities right now, I think, are way more open in a small private practice office situation than large institutions. My hospital, like Brian said, is completely locked down. No visitors, no shadowing, nothing like that. Only people who have to be there. But small offices that physicians own and run you have a better chance of getting into.
Okay. So a good place for them to start is just internally, in essence, kind of like starting grassroots. One thing that I've seen be successful is that in a class I saw an advisor challenge the student and said, "Hey, class is starting, it's 4:00. I want you to post on your social media that you're looking for someone to shadow. And by the end of class, we're going to check and see if anybody has responded." And it turns out that there was actually a pretty healthy response for a lot. Like, oh, my mom is, or my dad is, my uncle is, let me connect you, and it kind of surprised some of those students because I thought this would be a lot harder, but I actually do know a few people, or I know friends of friends of that. So that's a good way to get started. But just as Dr. Gill was saying, if it's on full lockdown, we may still kind of be stuck a little bit. What have you both seen as you've worked with students to kind of be creative outside of kind of calling someone and saying, tell me kind of what it's like to practice? Give me, if you wouldn't mind, give me 10 minutes of your time and walk me through your day. Have you seen anything else that's been successful? Or actually, I'm going to pause on that question because we're going to come back to it. What is the purpose of shadowing? Why is this such a big deal? What are these students supposed to get out of it? Dr. Gill, what do you think?
That is a great question. I hope to be concise, but the key thing that I would like to point out about shadowing is that it's not only to learn about the physician, the specialty or subspecialty you're shadowing in, but thirdly, and maybe most importantly, it's to really learn about yourself as a student. And so forecasting or projecting yourself as a student into the shoes of those that you're shadowing is a very healthy mental exercise of shadowing to think, wow, does this frighten me? Is this way too challenging for me? Or I'm out of my comfort zone with the situations that this surgeon is facing or this physician is dealing with on a daily basis? Or on the other side of that spectrum is this way too boring? Would I go crazy just sitting at a desk writing prescriptions for high blood pressure and diabetes medicines every day, day in and day out? And I think there's much a student can learn about himself in addition to what he thinks or she thinks they're learning about medicine or a doctor. So I'll start with that.
I love that because I've talked to one of the students I talked to last year that said the most profound thing to me is I talked to him. He's an amazing student, got accepted to University of Arizona, MD, PhD, by the way, great kid. And he said, if you haven't had second thoughts about being a physician, you haven't shadowed enough. And I thought that kind of wrapped shadowing in a nutshell for me, because people want to, I actually had a student contact me last week because she was interested in pathology, and I say 2 thumbs up. But pathology is not the most interesting profession to shadow, because we sit behind a microscope, and some people might find that boring. But then you learn that there are tedious things we do a lot in medicine. There really are. Brian has one of the more interesting full-time jobs in medicine. But, to say to yourself, is this right for me? What's the physician's place in this team of people? Because I have people that work with me that look at the specimens that Brian would send a pathologist. He's a surgeon. So I have a person who works with me and she processes the specimen. I think that's a great profession. You might learn that I don't want to be a physician, but I want that pathology assistant job because that's really cool. Right. And so you can see the team as well when you shadow. I think that's an important aspect of shadowing as well.
May I speak one more idea that just
Yes.
came? I've been interested this semester as the hospital and the OR, which is usually a really exciting place for students to want to shadow and to come. As that opportunity has closed, I've opened my clinic doors to the students. And every clinic day I've had students, and I have felt a little bad as a surgeon that, wow, this is just going to be boring time for them. I've been shocked with their feedback. They've been so grateful. They say, Dr. Gill, even when the hospital opens back up, you should have students come into your office. I have learned so much about what it's like being a surgeon outside of the operating room. For example, I serve as a private practicing surgeon in a group with partners, and I'm on the executive board. And during the day at the office, I may get non-clinical questions pertaining to the practice of our medicine team. I have to take phone calls, do a Zoom call, something. The students have been right at my side as I've gone back to the back office and talked with our finance people, our billing people, and they've observed me in more than just the practice of clinical surgery. And they said, wow, that's been really eye-opening. And since this, I believe, is a BYU audience we're speaking to, I can also bring in another element of that, is I currently serve as a YSA bishop. And there are times during my workday, whether it's in the operating room or at the hospital or in my office, in my clinic, that I get called and called upon to fulfill some service from an ecclesiastic standpoint. And it's been really great for the BYU students that shadow me to be able to ask me then, wow, what's it like balancing church service or community service with being a busy surgeon? It's great for me to be able to watch you take that phone call between patient rooms in your office. And that's opened up discussions with students and shown them a part of medicine that I think in the years before COVID, I wasn't showing because I always assumed they'd want to be in the operating room watching surgery.
Okay. I love that. So even kind of looking at it from a little bit more of a holistic perspective, I like to think that COVID has been annoying in a lot of ways, right? Like how blessed am I that I get to say that it's annoying and that's about it, right? But looking at it from the perspective of there's been a lot of really great things to come out of it, just even being able to showcase more of your practice so that people can see a bigger picture. So what, as we kind of look at this, what do you think, what helps a student have a successful experience shadowing? You know, have you ever, this is going to sound kind of rude, but have you guys ever had a student shadow you and you're like looking at your watch saying how much longer till this person's out of my face a little bit? Like, what's the difference? How can I help students know how to be better prepared so that, you know, they leave and you say, wow, I'd love to have you come shadow again. Or here, why don't you shadow my partner? What's the difference?
Before Paul answers that, I just want to say how important what the next things we're going to talk about really are to the students. Because even if you only get a 2-hour experience shadowing a physician, you start a relationship with that physician and you never know what that's going to mature into. They may invite you back, or you may be able to call back and say, is there any a time when I could come shadow you again, or in a different situation or clinical setting? So I think it's very important, first and foremost, to be your best self as a student shadowing, and to really look at the opportunity to meet any physician or physician assistant or nurse practitioner as a great opportunity, if not with that provider, with someone that they network with and would know.
Yeah, I like that. I would say, you know, and when kids come to shadow me, it can be kind of checkout time for it, right? And what I have noticed is that some students, some young people, when they come and watch, you can tell that they're there to check the box. And then sometimes they're there and they are engaged. And they are observant, they ask good questions, they're engaged in being there. Just they're all in, if you would. They're there to learn and to be there. And I think for me, it's that student who really is just there, you know. And as Brian said, be your best self, you know, be polite, be observant of others and such. And I think, but being truly being there is important.
So put phones away.
Yeah.
Now, we could do a list of do's and don'ts. Maybe I could give an example in the last month alone of
Yeah.
good student experiences I've had and not so good. I'll start with the not so good. It was a pre-med student that was assigned to come and shadow in the office setting. And he quickly, I assume, became bored. And in the office was a patient being interviewed by the surgeon's scribe, who's also a PA or healthcare provider, and the student. I would assume that all students would know that if they're not being spoken to or asked specific questions in the presence of a patient, that they shouldn't initiate in that setting. Well, this particular student initiated on his own and was talking not only to the patient, asking questions as the surgeon was trying to interview and do the proper history and physical on the patient. But then when the physician kind of shut that down a little bit, turned to the PA who was acting as the scribe for the interview and started to ask the PA non-clinical, non-pertinent information that was totally distracting to the whole patient interchange. So don't be that guy. All right. By contrast, I reluctantly was assigned extra student because my partner was out of town. So it was one more student that I had not anticipated having following me around. And it wasn't just a 2-hour assignment. It was an all-day assignment. So to be honest, I kind of thought, oh my goodness, this is going to be awful. This student turned out to be delightful. He knew when to stand back in the shadows, truly shadowing. But then after every patient exchange, I could tell that he was truly engaged, like Paul had mentioned. His interest was there. And the way I knew he was really and truly interested was on the very first patient. I was shocked to know or find out that he had watched 2 videos the night before of the very procedure, which was a rare new procedure that we do in surgery, that the first patient had performed. How that student found out that I was seeing a patient that had had that surgery done I'll never know. I asked him and he said, well, you have to be pretty careful, but you can do homework. So maybe a good student shadowing trick is to learn things from someone in the office about the physician or about the physician's schedule. And if it's published and they're willing to share it with you in advance, still recognizing all HIPAA requirements, maybe you could read about different procedures that are going to be on the schedule that next day.
I'm sure that made a huge difference, right?
Absolutely.
Yeah.
That's an impressive student.
Very
That's,
impressive student.
no, so when those two students came to you, Brian, which one would you write a letter for?
Well, I do tell about half the students that ask me for letters that I would love to write a letter for them, but I only write letters for those students that I feel I can rank in the top half of all students I've been exposed to in my 30 years of surgery. And so if I feel like they're not in the top half, I tell them that up front. And that has been really dramatic as to the response from the student. It has shocked most of the students I've told that to. It's been a good avenue for me to then have a discussion with them about what I felt as the observing physician they lacked. And as hard as that might be to hear, I feel like I help those students maybe more than the students I write the letters for.
Wow. I have said before that if every student could shadow Dr. Gill, they would be fortunate, because that right there is above and beyond. So way to go, Brian.
Yeah. Well, not shying away from difficult conversations is helpful and impressive. Do you feel, and this may sound like we're kind of being negative, and I don't want anyone watching it or either of you listening to it to kind of think that, but I would love to know, in a sense, that sometimes it's so helpful to kind of hear, of those 50% of students who aren't in the top half, are there commonalities outside of kind of not being engaged that would be valuable for students to learn from? Anything you can kind of think of that?
Well, I would say that Paul hit the nail on the head in his general statement about the engagement and the interest in the student. It goes, when he was talking about them engaging and asking questions, I have actually seen students know that it's proper shadowing etiquette to ask questions. And so they force questions, or they're like, if there's a quiet moment between patients, they think, oh, this is my chance. I can see their wheels turning, and then they are forcing themselves to come up with a question that really they're not that interested in. If you find yourself as a student in that situation, not having any idea what question to ask, try to put yourself in the physician's and think, where's the passion? Is this something that really drives the physician? And ask the surgeon about, or the physician, what's happening with this interchange? What I felt with that last patient was, wow, I was kind of threatened by the things they were saying. How do you deal with that? What does it feel like for you? And you engage the physician in a different way than just the check the box questions of specifics about diagnoses and treatments.
So looking at shadowing as an opportunity to kind of understand what attracted the physician to that position, and even saying, help me understand, kind of opinion-based questions to understand the practice better, outside of, because, right, like they're not going to understand all the logistics and the science behind it, and that's okay. But let's have a conversation about what draws you into it. Okay.
And I think those are fair questions to ask physicians. Questions that, how do you deal with difficult patients like the one we just saw? Or, wow, that seems like a pretty standard hernia post-op patient. Does it become drudgery to you, or what keeps the fire lit? Where's your passion in all this? What do you see? What do you keep going? What drives this?
Mm-hmm. Okay. Paul, do you have anything to add to that?
I could listen to Brian all day long, so I love that. I think that as I listened to what Brian said, it made sense because the student is emotionally involved and is true to themselves and what they're feeling. And to the students I've talked to who I believe have gotten the most out of shadowing are those students who dive deep into what they're seeing and why they're feeling it and asking the question, and instead of just like have this blank kind of drive, I want to be a physician because it's awesome or whatever, say, what's really driving the boat here for this doctor? Why are they doing this? The one thing that came to my mind is I've met students who are self-assured and confident, and that's not a bad thing. But I've also met students who are have misplaced confidence in themselves and their abilities, and I think that sometimes a reflection of that is the student that Brian talked about who was started to ask the questions to the patient out of place of the physician, and I think having the humility to step back and be okay not being the smartest person in the room, right, and asking, and being real about that. I would just be very humble about being there, but don't be afraid to talk. Just be very humble about being there.
Right? And it's totally appropriate to answer questions or even ask questions in the right setting. But when you're witnessing or shadowing a patient encounter between the professional physician or PA, that is not the time for you to interject as a student. I love the few things that Paul just mentioned, and I'd like to comment on a few of them. The part about being humble, and even if you are the smartest person in the room, and often the students that I meet now are so outstanding that they are head and shoulders above me and my intellect. So oftentimes I think they rightly would suppose they are the smartest ones in the room. But that still doesn't mean that there's something they can't learn. And it takes me back to my residency. There was a surgeon attending that we worked with that was notorious for being slow, and the residents hated being assigned to his cases. I was complaining about that along the party line of all my colleagues, all my other residents, one day when an R5 or chief resident pulled me aside and said, Brian, you're better than that. Don't complain about Dr. So-and-so. He says, I can't tell you what I have learned as soon as I switched my thinking about scrubbing with him. I said to my co-resident, I said, well, teach me what you learned. And he said, Dr. So-and-so is so slow and deliberate in the operating room that when I was assisting him, I found that I had time before his every move to put myself in his shoes and say, I would put the needle angled at 45 degrees, take the tissue that way. And then I would watch and see if he did it that way or not. And if he didn't, I would say, Dr. So-and-so, I would have taken it differently. Why did you do that? And all of a sudden he became a master teacher and a master learner. This other resident of my friend learned that he could silently observe and project again himself into the physician's shoes and make choices and be actively engaged in learning surgery when he was doing nothing but standing there holding a retractor. Changed the way I looked working with that physician.
Oh, I love that. I love that story. Thank you. Okay, so I guess now we get to ask kind of the question of, okay, so in the meantime, when things are so locked down, we've talked about kind of using their social media, using their friends, trying to kind of advertise that. I'd love to, if not shadow, even just chat with some physicians. Do you have any other kind of suggestions or tips? I mean, one thing that's out there right now is the whole idea of teleshadowing. Is that valuable? What do you think about that? If it is valuable, how do you kind of track that to show that it's valuable? What are your thoughts?
That's an interesting question. Just this morning in class, I had 2 students report back on their experience with e-shadowing, or this teleshadowing. And so we talked about it for a few minutes. And there are, the e-shadow program at least has certificates. If you participate in an e-shadowing session, there might be up to 200 other students there, and you can't really engage verbally, but you can participate with questions by chat if you have something that comes up, and the other students can benefit from that as well. And then at the end of the session, this particular platform asks the participants or the students questions to validate whether or not they were paying attention and were engaged to what had happened. Then this particular platform generates a certificate that's recognized, by my understanding, by the medical schools and can be counted as legitimate hours. So I think that that's a very viable thing to do, especially if you have no idea about different specialties. Using the teleshadowing or the e-shadowing platform is a great way to find out about things that you don't have any other opportunity to see.
Okay. What's the difference between kind of like the teleshadowing, e-shadowing, and maybe just kind of watching a physician present, like in our health professions course? Is there a huge difference there, or do you think kind of like that certificate and asking the questions back provides a little bit more?
I think it's very different because typically the e-shadowing will be some sort of physician or healthcare provider carrying his phone or her phone around during normal work activities, not just standing at a podium or sitting in a room like we are right now talking about it. So they can see, wow, it takes a lot of time to get from the pathology lab back to the doctor's lounge or up to the patient floor. And so there's a lot of the downtime, and they could see actually where they're going and what they're doing. I think that there is value in that, because one of the students also this morning commented that she could feel the energy of the hospital when she was watching. And she identified with the energy. And if it's a pediatric hospital, it's a different feeling than if it's a geriatric hospital or a trauma hospital predominantly. And so feeling that energy was something that was really exciting to this student I spoke to today. She felt like, wow, that is the energy that I want in my career. And she was able to identify that just by observing what it was like to walk around a pediatric hospital.
This is fascinating listening to Brian talk about this, because when I've thought about or I haven't actually participated in e-shadowing and as far as watching it, right? And so I was a little bit jaundiced about it. I didn't know how I felt it would really add to the education of a pre-med student, but I can see that there is some opportunity. I would think that some e-shadowing may be a good thing in that, but I don't know. It's gonna be interesting to see how that turns out. I hope it's a good thing and adds another possibility to it. Right. And I would add that, I mean, I know I talk to students and they're all worried about shadowing and COVID. And so I looked upon the University of Utah website, the med school today, and they have an asterisk when it talks about clinical experiences. Due to COVID-19 and other general patient privacy concerns, the committee recognizes that there are many barriers for pre-medical applicants to shadow healthcare professionals this time. I think the point of that is that the schools know, right? The schools know how difficult this is. And if you could get, 20 hours of e-shadowing and 20 hours of in-person shadowing, but then I think the other caveat is I think medical schools will want to see that you just didn't sit on your hands and wait. Instead, you said, okay, I can't shadow right now as much as I'd want to. I e-shadowed a bit. I called these physicians, but then what did you do with your time? Did you find ways to serve in your community? Did you find other avenues to gain clinical experience? Did you get a CNA certificate? Did you get an EMT certification? I mean, what did you do with your time to prepare yourself to understand what medicine is really like, right? And so if you're just waiting, then I say find something to do. Whatever that is, just be engaged in the process of preparing yourself.
That is great advice. It brings to mind something that I'd totally forgotten about, but you brought it back to my memory. And that is, I know of 2 students who have used the COVID crisis to their advantage by contacting the county health department and volunteering that way. And they were able to actually become vaccinated with the healthcare providers because they were willing to work in the vaccine clinics. All they were doing is patient intake, checking people in that were able to get their vaccines, but they got the exposure. They met a bunch of nurses, they met some doctors, and they were working and had hours with the health department. So I thought that was a very creative way for them to go outside of the box and show that they're really interested to be a part of the healthcare team.
That's a great story. I love that.
Um, one thing I want to kind of remind students as they're watching it is just the power in kind of reflecting after the shadowing experience and really kind of putting that down. It's so amazing to me how easy it is to say, I will never forget that. And a week later, you have completely forgotten it. And so just recording, writing down insights, and just even kind of processing it a little bit is so valuable from the perspective I have when I help them with the application, to then be able to really see that the experience was impactful, even when at the end of the day, you're like, yeah, that was cool, and then move on. You give it a little bit of time and they have such a better kind of like, oh, I saw some things. I have a better sense of what I'm interested in and what I'm not interested in too.
That is such an excellent point. In my class, we do surgical reflections after they've done each of their shadowing experiences. And some of the questions that I use as prompts for their write-ups on that address that very thing, and would be wonderful for them to keep in their phones or in their journal or whatever they have. And I have them usually identify things that made them nervous, things that made them uncomfortable, that made them jittery, and things that bored them, things that overwhelmed them, but they felt like they could learn and grow into. I think that those 3 things that overwhelmed them, but they can grow into, things that bored them, and then other things that made them anxious, are very important things to detail with each specialty that they observe. And then at the end of the day, what did I learn about myself through this experience? And jot that, commit it to writing, write it down. And can I see myself growing into this as a career? And if you say, no, there is no way I could ever be a surgeon, well, then you don't need to go and shadow a neurosurgeon, an orthopedic surgeon, and a general surgeon, and a urologist. You can focus on pathology and other medical subspecialties.
Pathology. It's where it's at. We have all the answers. We have all the answers.
That's true. So I think maybe one thing that I'll also highlight for students that are watching it is just a lot of times students will ask, well, how do they check it so that medical schools know that I actually did it? And it's all self-reported, really. And so having good data, tracking it so that when you put it into your application, you have confidence that you're reporting correctly is so valuable, and that you're not shorting yourself, right? Like, I don't want to say that because I'm not sure if it's that many hours, or you end up grossly overestimating as well. Like, neither one you want to do. And so just tracking this stuff is so valuable from that perspective too. So one other thing that I think I know both of you have experienced is just the idea that maybe it's popular to be able to go down the hill and to hit up the hospital at IHC or just run on over to American Fork. But what do you encourage them to do instead? This is my hint to say, get outside of Utah County.
Well, Paul can talk to that, but I'll say even in Utah County, the hospitals aren't the only place to gain patient experience.
Yeah.
There's a state mental hospital where a lot of BYU students have discovered lots of things about themselves and about patient care and healthcare careers. There are lots of nursing homes, skilled nursing facilities and rehab centers, and you've got to think outside the box a little bit. And those all count as clinical hours, patient exposure hours. And those are still right here. I know I'm not answering your question correctly. But
I'll
those,
still take that. It's still a good answer.
so Paul, I know you have experience outside.
Well, I think that my son was a pre-med student at BYU, and he faced these same things. And so when he came back home, he would shadow. I have a really good friend of mine who's a pediatric oncologist, and Ben thought he wanted to be a pediatrician, so he shadowed that guy over Christmas breaks and stuff like that. I mean, if you are away from Utah, taking advantage and thinking, where might I do this? How can I get this done? I grew up in Vernal, Utah. We're working with a physician as part of the BYU Medical Society out there in Vernal, who thinks we can hopefully set up a shadowing opportunity outside of Utah Valley in the clinical, in the kind of the rural setting, which is a different form of medicine than you're going to see, at least in the ORs with Brian. And so there's opportunities if you look for them and ask and look. But I would second Brian's thing about, if you can't shadow a physician, then look for clinical hours. I'm a big fan of hospice care. My father and my father-in-law benefited so much from hospice care. And they had one hospice volunteer who would just come and talk. My father-in-law had dementia and he's dying of cancer, but he was a very happy guy. And they would just come and talk to him, and he loved it. He loved to talk about his life. And I think that you can learn so much about what it's like to care for somebody as a CNA or as a hospice volunteer or anything like that. And those are extremely valuable experiences.
Okay.
Great. I'm sorry, I've got to say one more thing. Just
No,
this
please.
happened again today. Take advantage of you and your family's health and dental problems yourself. A student just today reported to me, someone went into a physician's office, not for anything big, and had an appointment with a doctor. And while there, just by asking questions and identifying as a pre-med or a pre-health professional student, was offered a job because the MA said, that was there helping with the information, said, you know what, I'm quitting. My job's open. Why don't you ask him if you can have my job? And that opened up an avenue. So if you've got to have your wisdom teeth out, if your sister is having hers out, go with them. Be the person that goes and just rub shoulders with as many different healthcare providers as you can and network when you're there. Everybody is happy to help when they can.
I love that. I'll follow up with that idea of network, because sometimes that term scares me a little bit. I'm like, that just means I want something from someone. But what I've found is that if students are willing to be brave enough to say, this is what I'm interested in, you can't stop people from trying to help you with it. But you just got to kind of like say, I'm thinking about it, and just getting that out, which is sometimes scary because you kind of think, I don't know, I'm not sure. But, so I love that idea of just being willing to talk about it and say, I'm thinking about, and I think opportunities come from that. And I'll reiterate just kind of the idea of taking advantage of when you're somewhere else, wherever that is, and kind of looking at perhaps that physician population that may not be as overwhelmed with people kind of asking to shadow and everything as well. Just opening it up and recognizing that you have these pockets of time where you can really build on it. Thanksgiving, Christmas, our spring break day, like all of those things can add up if you're thoughtful about using it strategically. So
great advice.
Yep.
My 2 cents. So thank you, both of you, so much. I think hopefully students, as you've watched this, you've found some value and some thought about how you can improve your shadowing experience, how you can find shadowing experiences, and how our office wants to help you be as successful as possible. All right, so thanks.